Well, we've been married for 40 years. We met in Albuquerque. I was still a senior in high school. He was going to college there in Albuquerque.
I just graduated the year before.
And actually 4 months later we were married. I graduated from high school into marriage. And we lived there in Albuquerque for about 5 years, and then decided that his career, which was in welding at that time, was more available in Kansas. And so we moved to Kansas, and we spent 12 years in Kansas, and then we moved back here in '85. And after we got the diagnosis, I started looking up this disease, and I was actually really surprised what this disease can do to someone.
Well, I came to Hatch to be with my parents. They were pretty fragile and did not want to go up to Wyoming. But I do miss it. I had a job there that with the Casper Star Tribune, the Letters Forum, and music and poetry series where we went around the state, and lots of fun, lots of music, lots of poetry, lots of fun. I remember when my mother said, you know, this is going to be like camping, but I really like Hatch, and I enjoyed working in my dad's garden, and he broke his hip in 2006, and that changed everything. He became bedridden. Then Mama became wheelchair bound. So that meant 24/7 care. It was working all right until I became sick in October. And I would I would try to get up in the morning, and it would take me forever to get dressed.
I'm a college professor, and very fortunate that with this disease I can teach from home because I'm an online teacher. And it's kind of the light of my life right now, other than my grandson, because I teach teachers at the graduate level, and I get to learn all about their subjects all the time. So it came in really handy recently that I was teaching because I had another bout of pneumonia. So I was in bed, and I was teaching from bed. And I can do that. I've done it many times. So my students don't even need to know that I'm having a rough time. But it's been a pretty debilitating disease.
The borderlands of the great American Southwest. Texas, New Mexico, Arizona, California, and northern Mexico itself. A land rich in history, tradition, agriculture, cattle, dairy, tourism, and an insidious disease which many in the medical profession and general public know little or nothing about. A disease which lies dormant, waiting to infect humans and animals without discrimination.
This disease called valley fever, its medical name is coccidioidomycosis, or COXY for short. Desert rheumatism, there's a variety of other names. Coccidioidomycosis is caused by Coccidioides immitis. It's a fungus that lives in only certain parts of the world, and we actually live in one of those. The southwest deserts of Southern California, Central California, Arizona, New Mexico, and into Texas are the areas where the fungus likes to live. Its location is primarily in the soil. It only occurs in certain parts, which is a puzzle to ecologists as to where it lives and where it doesn't. But in broad terms, it's a southwestern disease. It causes infections in many mammals, including us. Dogs actually are very susceptible to this, also llamas. You get an infection if the spores that develop in the dirt get disrupted and get into the air over a breezy day, or if people disrupt soil. And these spores then they're small enough to stay in the air for perhaps indefinitely, for long periods of time, certainly. And if you happen to inhale one of these spores, it goes deep into your airway, down into your lungs, and as a result can start an infection.
Once a fungus spore is inhaled into the lungs, the round cell develops into a spherule by repeated internal division. This happens within 48 to 72 hours after the spore has been inhaled. If and when a spherule ruptures, it releases hundreds to thousands of endospores, which can also replicate and travel throughout the body via the bloodstream.
If you get an infection, you may or may not get sick. About 2 out of 3 people who get infected actually have no symptoms that are significant enough that make them want to seek medical attention. But 1 out of 3 people will develop an illness, and most of those develop basically a community-acquired pneumonia. The kinds of symptoms you get with that kind of an illness is chest pain, cough, often fever, night sweats. Weight loss can be a very common symptom with this form of pneumonia. If you seek medical attention for this, a doctor won't be able to tell whether it is a pneumonia caused by this fungus, or a pneumonia caused by a bacteria, or a pneumonia caused by a virus. Clinically, you can't tell the difference between valley fever as a cause of this pneumonia and anything else.
So cocci is a disease that is acquired environmentally from your environment, from the soil where the disease is endemic. Now, cocci cannot be spread from person to person, like, for example, influenza. So there can't be these contagious epidemics of cocci like there are with some other causes of pneumonia. So it seems likely that because this is acquired from your environment, that people who spend a lot of time outdoors are most likely to get infected. And in fact, that does seem to be the case. People with occupations like construction workers or people who are working in landscaping tend to be more likely to get the disease. But it's important to remember that it only takes 1 spore, so that in fact people can acquire the disease simply by walking down the street. We've had cases occur of people who've actually only been passing through the airport who've got infection. So it's really quite amazing that it really only takes 1 spore to get infected, and you can get infected in a multitude of areas. We think that in Mexico there is probably as much disease as there is in the desert areas of the Southwest. But one of the issues in Mexico is that it's not clear that the capacity exists to diagnose the disease in Mexico. So although we think that it's highly prevalent in Mexico, we just don't have a lot of data about it.
In June of 2004, I went in because I had pain in my abdomen, and I had ultrasound done where they found tumors, what they thought was tumors. And I ended up going up to Colorado to have surgery. At the time they thought it was ovarian cancer. They were pretty certain that it was ovarian cancer. And so they did the surgery right away. It wasn't cancer. They didn't identify what it was. They only identified that it was benign. And so the tumors, or whatever they were, burst during the surgery. And they weren't able to capture any of them. And then they sewed me back up again, and 3 days later I came home. I was released from the hospital. I came home, and I was recovering. And then all of a sudden I had a rash, and I went into the doctor here in southwest New Mexico, and they put me on steroids and said that I was probably having an allergic reaction to shrimp. And I did those steroids for a few days. I continued to become more and more ill. I was coughing a lot, having trouble breathing, And ultimately, the ambulance had to come and get me to take me into the hospital. I was really in bad shape. I had pneumonia in one lung. And they put me right away. Well, they did a lot of tests there. They did CAT scans. They did a test where you go in this little room and you breathe in radiation by yourself. They leave you alone. Plug your nose like this and you have to breathe in radiation for 45 minutes. I don't know what that test was, but it was scary. And just a series of tests, and what they ended up with was pneumonia and put me in the hospital. My lab work came back really strange. Everything was either high or low, or it was all over the place.
February of 2008 is when you started having symptoms.
Yeah, I started having leg pains, and my legs were hurting a little bit more, and
Chronic fatigue.
I was getting tired a lot more in the afternoons. And one day we were flagging a fence line, and I started feeling a lot of pain underneath my right armpit. And I figured that I had pulled a muscle, because riding ATVs, for a couple of days and that. So I came and we had a banquet dinner for my granddaughters for high school. So I bandaged myself up, and she came home that day.
I asked what he was doing and what had happened, and he says, "Oh, I think I pulled a muscle." And I said, "Well, all right." And we went to the banquet, and I noticed his color wasn't doing good, and he was having like a little bit of shallow breathing. And that night we got home, I started looking up on the computer about pleurisy, and I remember him having pleurisy before. And I asked him, "Do you think this is pleurisy?" And he says, it does feel that way. And I said, "Well, we need to make sure that we watched for fever and stuff like this." And sure enough, about 2 o'clock that morning is when he woke up just with really bad chills and fever. And I had already called the doctor that night, but we couldn't get in to see him until till Friday. And but we went ahead and went into the emergency room after that.
And that's where they took a chest X-ray, and then they came back and said that I had pneumonia. And so they gave me antibiotics and everything. That I had a choice to either stay there or come home. But if the symptoms worsened, to go back in. So we came home, and I took the antibiotics and that, but I went back to work.
No. The next day.
Yeah,
You did go back to work that next day.
To work.
And but you had a doctor's appointment with our primary.
Yeah.
And so he said, "Well, they did diagnose you with the pneumonia," he said, "and just to make sure, because of your lung history," he says, "let's go ahead and give you a pretty strong dose of it." And at that point in time, he started taking it and started breaking out in a rash. We associated it with maybe he was having a reaction to the medicine. But now that we think back, we think it was the valley fever that was actually coming out of him.
I went to the doctor the 15th of November 2010, and he took steroids to open my lungs, steroid shots, and albuterol for the nebulizer and an antibiotic. And I thought, well, okay, maybe it's just bronchitis. But I was having chills and fever and everything by the 15th of November. Toward the end of the November, I felt almost good enough to think I was coming out of it. And I got Mama transferred to Sierra Health Care, another nursing home in Tier C, so we could just transport her to see Daddy, 2 or 3 times a day. They were so used to seeing each other that it was very, very hard for them to go days without seeing each other. They've been married 75 years. So I got sick again. It was my birthday. I remember that because a friend of mine got me an opera ticket. Opera ticket was on my bucket list. So I could not go. I was very sick again. It was like harder than in November. The doctor gave me Cipro this time, heavier antibiotic, and the steroids and the nebulizer and the breathing treatments, and had me take nebulizer treatments at home and see if that would take care of it. Toward the end of the December, I saw the lung specialist because on December 6th he also took an x-ray and he saw the little spot on my lung. It's about the size of a marble. And so he sent me to the lung specialist, and that meant CAT scans. He's seeing it. He's recommending a bronchoscopy. So that's what we do. We do that, and the 1st of January we do the bronchoscopy. I am sick then again by January 13th, just sick. So there we are, back with the antibiotics and back with the steroids, and this time an IV for dehydration, you know. He had felt like the bronchoscopy didn't really show. It was right between my lung and my breast, and so it was hard to get to in a bronchoscopy. So he suggested a needle biopsy. And I'm very, very glad that he did, because it wasn't cancer. It was valley fever.
In New Mexico, coccidioidomycosis, or for short COXI, is a reportable condition, which means it's mandated by state regulation to be reported if there's a laboratory result or even the suspicion by a clinician or the general public that somebody has this disease. However, what we've seen along the U.S.-Mexico border, particularly in Arizona and California, are large increases over the past several decades in people diagnosed with COXI. In New Mexico, we know that we have between 20 and 60 cases total per year. But in Arizona, in the last several years, there have been 10,000 or 12,000 cases each year. This has led us to the hypothesis that people aren't getting tested and diagnosed in New Mexico as much as we think should occur. Last year in New Mexico, we worked with key stakeholders, particularly in the southern part of the state, but around the state, in order to embark on both an educational process with clinicians to educate them about COXI, as well as a survey for their knowledge, attitudes, and practice regarding coccidioidomycosis in New Mexico. Results from the survey showed that basically 70% of respondents did not consider COXI in their differential diagnosis when they had a patient presenting with symptoms that are typical of COXI. Another interesting thing is that the respondents stated that very few of them, like about a third, stated that they had ordered tests for COXI. So what that tells us is that they're really not considering this in the patients that they're seeing that have symptoms consistent with the disease. Furthermore, 91% of the respondents said that to their knowledge they hadn't cared for a patient in the last year who had the disease COXI. From the survey results, we saw that over 50% of the respondents stated that they thought COXI was a problem in New Mexico. However, less than a third of those respondents said that they knew how to diagnose and treat the disease. So what this survey really tells us is that clinicians in this endemic area, or an area of the world where COXI is found in the soil and causes illness in people, are really not considering it in the diagnosis of people with consistent symptoms, and they're not testing for it. So this really leads us to believe that in New Mexico, this disease is underreported.
What's happened over time is that there's not univocality in the field about valley fever among doctors. And it is very costly when you're misdiagnosed and you are given a medication that makes it worse, so you have to go back again. My experience like a month ago was that I went in for pneumonia. I went to the emergency room. They diagnosed me as having pneumonia and pleurisy. And so then I followed up, as they said, 3 days later with a general practitioner who said, I think you should be on antihistamines. I've had all these tests which say, yeah, we see tumors, or yeah, we see fibroids, or yeah, we see lung cancer when it's not lung cancer, we see abdominal cancer when it's not abdominal cancer. All those tests cost lots and lots of money.
We were just looking for answers because, you know, everybody, the doctors we'd go through, you know, they ran tests and x-rays, but they didn't have no idea what was going on. So they would, we'd go to another doctor, they'd send us to, you know.
We're basically being pushed around from doctor to doctor to doctor. Nobody wanted to hear about valley fever. I actually don't think that they knew that much about valley fever, especially in this area. And it was really frustrating to me because after living with this man for 40 years and knowing how strong of a person he is, and he was basically disappearing before my eyes. And I expressed this to the doctor that I'm losing my husband. I know my husband. Something is terribly wrong. At that point in time, I think they were kind of confused because they were running tests for TB, AIDS, every kind of disease I think that they could think of. And everything kept coming back negative. They kept saying, we're really confused. This thing is growing at a rapid rate, and cancer usually doesn't grow that fast.
Lung doctor came in, and that's when he told us that that's what they thought it was, cancer, that we had to, you know, go in right away.
And I think at that point, that was the lowest point of our life.
Yeah, he said.
And that was really hard to take in.
Yeah, that because, you know, that's their first time facing that disease, and like he says, that he was just expanding too quick, and by the time they needed to get in right away because it was already attached to the bronchial and the main artery, and that he was closing the bronchial. The airway. So
they did the surgery, and he came out, and he was actually really excited and said, it's not cancer. And he said, it's valley fever. But we had to go through all this to find out that it was valley fever.
So we think that, for example, in the state of Arizona, there are probably 100,000 infections every year. Of those 100,000, maybe only 30,000 actually seek medical attention. But we have from state statistics that only 10 to 12,000 patients every year are now being diagnosed with that. So it looks like probably 2 out of 3 patients seeking medical attention for an actual valley fever infection are misdiagnosed or not diagnosed at all. It's very important for us to know about this disease, those of us that live in the Southwest, and it's as important for people to know about this as it is for doctors, because you can avoid other therapies that are of no use. For instance, if you treat this as a bacterial infection, when in fact you have a fungal infection, none of those antibiotics will do you any good and often have side effects which we'd like to avoid. Also, if you know that it's this problem and not something else, you don't have to have as many diagnostic tests. A lot of unnecessary medical care can be avoided. In fact, one study showed that people who knew about this disease before they got sick got a diagnosis faster than those people who didn't know about the disease before they got sick. It's as if those people asked their doctors, could I have valley fever? And it seemed to make a difference in the rapidity of getting the right tests done to make a specific diagnosis.
About 60% of people who contract the disease by inhaling the spores that are found in the soil will be basically asymptomatic. They won't have any signs or symptoms, and they won't feel ill. 40%, however, will feel ill with fever, fatigue, cough. The vast majority of that 40% will get better on their own. However, a certain subset, maybe 1 or 2% of those, so 3 to 4 of those patients, will have a recurrence at some point in time in the future. Out of the 40%, 1 to 2% of that will go on to have disseminated disease, which can lead to very severe illness, lots of medical care required, surgeries, different procedures in order to try to get them to achieve a cure. They might be on certain antifungal medications for long periods of time, and certainly it incurs a great cost to them, both in their health as well as to the medical system in New Mexico.
The financial stress that it has caused us and the hospitalization was about $89,000, which thank God we had insurance, but we also had our part as far as co-payments and percentages and things like that takes a real big financial burden on the family.
Oh, you pay your co-pay at your doctor's or over to the specialist so that they will go ahead and hopefully pay the rest. It was just really hard. That was money straight out of my budget. If you take money that you've designated for the propane for your heat house, or you take money designated for your car insurance or for your tires, how do you make that money back up?
So it's important to realize that anybody who lives in the endemic region can become infected with this fungal infection. For those people who do develop complications, they may have recurrent disease that spans years, even decades. They may lifelong treatment to prevent those complications. And those patients become individual cases into themselves. If, for example, you have an infection that goes into one knee, how to manage that particular problem is going to be specific to how that patient needs to be managed. So it becomes a very wide spectrum of manifestations depending on where the infection actually settles. But for that subgroup, those people who have complications, it's not uncommon for them to spend years, if not their entire life, having to kind of keep this under control.
I've had pneumonia a few times. I've fatigue easily. There have been many things that I associate with valley fever. And one of the things is pain in my legs and pain in my ankles. That started with all this, and just a lot of things, mostly lung things. If I'm exposed to something like a cold, then it gets really bad fast, which happened recently. And so it's just been a battle for all these years. It feels like remissions where I'm highly energetic and I love life and I'm gardening, I'm doing all these things, and then I get hit with it and I'm down for a long time. There are a lot of hard days. There are a lot of days where I'm in pain, tremendous pain in my legs, and so I'm lying down and putting hot pads on my legs and things like that just so that the pain goes away. I used to be a singer. I'm a musician, and I can't sing because I don't have enough strength to make the sound anymore. So that's pretty upsetting. It was a huge part of my life.
A bad day is when you feel like you're choking to death. And because you're choking up so much phlegm and stuff, you vomit. And then you get the shakes, and you're cold, and you're hot, and you know, the flu symptoms basically, flu does not last 5 months. So it ought to be, you know. So it was really rough. It was really rough. Those were days I could have had with my folks. My dad died. He died in May, and so I had the last 6 weeks with him. And that was great because I was feeling well enough that I could make him little treats and hang out at the vet home and do Mom's hair. And yeah, and I have her now. I'm very lucky. They're human things, and I know that people go through a lot worse. I know it could have been cancer. That was scary, the big C scare. And I know that how lucky I am that I got over it on my own. It was just so unnecessary.
I have days where it is much easier to get out of bed than other days. And the depression is pretty monumental. It's pretty monumental because if it gets worse, you know, if it gets any worse than this, how can I even take care of myself? You know, I'm not sure. If I can't hear, if I can't cook, you know, it gets really scary.
Actually, the one day that I came home, and I had never seen my husband, I think, at his lowest point. And he said, "This is the first time in my life," he said, "that I actually thought about taking my life." He says, "I don't wish this disease on anybody." Patients live with this disease. It doesn't go away. It does damage.
I've always been a hard worker. I've always been able to do stuff by myself, my own. I've found out that I can't do a lot of stuff. I find myself getting very tired and fatigued, and I wake up with pain every day, and I go through it. I've made a routine in the morning, what I do. You know, if there's anything to do around here, outside, I'll go try and do it, and then if I get tired, I come in, I'll sit down, I'll read, and then I got my shop, you know, my little hobbies that I do, and I try to keep my mind busy this way. The pain, you know, I still try to use mind over matter, and some days it works, some days it doesn't.
I find that if I'm exposed to germs, then I get sick, really sick fast. So I stay away from people. I've given up on most extracurricular kinds of activities. I used to love to dance. I don't dance at all now. And I never go out at night. I'm probably in bed every night by 8 o'clock. And I have to say no to a lot of things that I love. A lot of times I cry by the end about the pain because, you know, I want to go for a walk. I want to go horseback riding. I want to do things. And that really gets to me.
I took 4 different kinds of antibiotics within 3 months and saw 4 doctors. I took the diagnosis from the needle biopsy and showed it to my doctor. Yeah, on March 3rd, the diagnosis came out that it was coccidioidomycosis. That was just the zebra among the horses, so it was really, you know, first you take care of the horses and then you look for the zebra later. That may be true, but like a friend of mine says, you gotta know what the zebra looks like.
So what are we doing in New Mexico about cocci? Well, we're taking the problem very seriously, and we want the underdiagnosis and the underreporting to be corrected. And so we're embarking with the Centers for Disease Control and Prevention, as well as experts in Arizona who see thousands of cases and are affiliated with the Valley Fever Center for Excellence in Tucson, to provide educational materials to clinicians in the state of New Mexico. We've had sponsored some continuing medical education credits so that clinicians can receive credit for learning about this disease. And we've also provided conferences where clinicians can gather and meet and hear speakers that are experts on the disease and learn how to diagnose and treat their patients appropriately. We're also attempting to educate the general public. Lots of people have never even heard of this disease, let alone know when they have symptoms that are consistent with other viral illnesses or other common colds, that when they see their physicians, they should talk about, is this possibly cocci and what does that mean to me? So what we want is clinicians to do the simple blood test early, diagnose the patient, start appropriate therapy as indicated, so that we can prevent those misdiagnoses, delay in diagnosis, and long-term complications. The New Mexico Department of Health is working with the public health authorities in Arizona and in the Mexican states of Sonora and Chihuahua in order to develop capacity regarding cocci in this region. And what I mean by capacity is that we're developing educational materials for the general public, for clinicians, and for patients, as well as trying to enhance the availability of clinical diagnostic testing in order to provide for clinicians the ability to test for cocci.
Well, physicians anywhere should know that valley fever is a very important disease within its endemic regions. So even physicians well away from the endemic region, if they have a patient who has recently traveled to an endemic area for valley fever, should put it on the radar. Inside the endemic regions, it's very common, and I think doctors any doctor seeing patients with new illnesses should be familiar with this. At the Valley Fever Center for Excellence at the University of Arizona, we're trying to help with that. On our website are both medical education programs and also other information to help clinicians as well as the general public understand this disease more.
People who are at higher risk for developing severe disease, and these people include people who have weakened immune system, for example, if they're receiving steroid treatment or they've had an organ transplant, or persons who have HIV infection, or also people who are African American or even of Filipino descent, and also women in their third trimester of pregnancy. These are the groups that are at high risk for getting very severe disease from cocci.
The biology of this disease shows that so often the human immune system is able to control the infection. It's so tempting for us to want to have a way through vaccination to prevent this disease entirely. It's an exciting idea. People are working on that, but the reality of vaccine development is that it takes a long time and a lot of financial support.
Being tested for the disease is quite easy, actually. Often people will have a blood test, a simple blood test, to check for antibodies to the cocci infection. And this can be quite helpful in many cases.
We think that risk every year in Arizona, for example, is 3% per year. And it may be simply the fact that you're living here is the risk. Now, it's a manageable risk. I don't think that that it is necessarily something that should scare people from living in this beautiful part of the world. But it's better to know that it exists and manage that risk than to pretend it doesn't exist at all.
You can get back the money, maybe, and you maybe even get back your health. But that time, time is where our memories are. They hold our memories, and that time was lost.
One of the worst aspects of the disease is the emptiness that you feel and the loneliness, because the person that you used to be is no longer there.
This week I emailed my friend Annie that also has this disease, and I said, I miss my husband. I miss what we used to have. Even though he's here in body and in mind and in soul, I do miss what we had. This disease has taken.